Global economic effects of COVID-19. Since the COVID-19 outbreak was first diagnosed, the spread to over 190 countries in the US states. The pandemic is having a noticeable impact on global economic growth. Estimates so far indicate the virus could trim global economic growth by as much as 2.0% per month if current conditions persist. Global trade will so fall be 13% to 32% common depending on the depth and extent of the global economic downturn. The full impact will not be known until the effects of the pandemic peak. This report provides an overview of the global economic costs to date and the response by governments and international institutions to address the effects. Overview. The World Health Organization (WHO) first declared COVID-19 a World Health Emergency in January 2020. Since the virus was first diagnosed in Wuhan, China, it has been detected in over 190 countries in all US states. In early March, the focal point of infections shifted from China to Europe, especially Italy, but by April 2020, the focus shifted to the United States, where the number of infections was accelerating. The infection has sickened more than 3.2 million people, about one-third in the United States, with thousands of fatalities. More than 80 countries have closed their borders to arrivals from countries with infections, ordered businesses to close, instructed their populations to self-quarantine, and closed schools to an estimated 1.5 billion children. In late January 2020, China was the first country to impose travel restrictions, followed by South Korea and Vietnam. Over the 5-week period from mid-March to late April 2020, more than 30 million Americans filed for unemployment insurance, raising the prospect of a deep economic recession and a significant increase in the unemployment rate. 3 Preliminary data for the first quarter of 2020 indicate that U.S. GDP fell by 4.8% at an annual rate, the largest quarterly decline in GDP since the fourth quarter of 2008 during the global financial crisis when the U.S. economy contracted by 8.4%. Foreign investors have pulled an estimated $26 billion out of developing Asian economies and more than $16 billion out of India, increasing concerns of a major economic recession in Asia. Some estimates also indicate that 29 million people in Latin America could fall into poverty, reversing a decade of efforts to narrow income inequality. In Europe, over 30 million people in Germany, France, the UK, Spain, and Italy have applied for state support of their wages, while first quarter 2020 data indicate that the Eurozone economy contracted by 3.8% at an annual rate, the largest quarterly decline since the series started in 1995. The pandemic crisis is challenging governments to implement monetary and fiscal policies that support credit markets and sustain economic activity. In doing so, however, these policy approaches are displaying differences between countries that promote nationalism versus those that argue for a coordinated international response. They also are intensifying policy differences between developed and developing economies and in Europe between northern and southern members of the Eurozone. After a delayed response, central banks are engaging in an ongoing series of interventions in financial markets and national governments are announcing fiscal policy initiatives to stimulate. The IMF estimates that the increase in borrowing by governments globally will rise from 3.7% of global gross domestic product, GDP, in 2019 to 9.9% in 2020, as indicated in Figure 1. Among developed economies, the fiscal balance to GDP ratio is projected to rise from 3.0% in 2019 to 10.7% in 2020. The ratio for the United States is projected to rise from 5.8% to 15.7%. For developing economies, the fiscal balance to GDP ratio is projected to rise from 4.8% to 9.1%. According to the IMF, France, Germany, Italy, Japan, and the United Kingdom have each announced public sector support measures totaling more than 10% of their annual GDP. Among central banks, the Federal Reserve has taken extraordinary steps not experienced since the 2008-2009 global financial crisis to address the growing economic effects of COVID-19. The U.S. Congress also has approved historic fiscal spending packages. In other countries, central banks have lowered interest rates and reserve requirements, announced new financing facilities, relaxed capital buffers and, in some cases, counter-cyclical capital buffers, adopted after the 2008-2009 financial crisis, potentially freeing up an estimated $5 billion in funds. 10 capital buffers were raised after the financial crisis to assist banks in absorbing losses and staying solvent during financial crises. In some cases, governments have directed banks to freeze dividend payments and halt pay bonuses. On March 11, the WHO announced that the outbreak was officially a pandemic. The highest level of health emergency. A growing list of economic indicators makes it clear that the outbreak is negatively affecting global economic growth on a scale that has not been experienced since at least the global financial crisis of 2008-2009. Global trade and GDP are forecast to decline sharply at least through the first half of 2020. The global pandemic is affecting a broad swath of international economic and trade activities, from services generally to tourism and hospitality, medical supplies and other global value chains, consumer electronics, and financial markets to energy, transportation, food, and a range of social activities, to name a few. The health and economic crises could have a particularly negative impact on the economies of developing countries that are constrained by limited financial resources and where health systems could quickly become overloaded.